Everyone can hear me through the mask. I'm a bit of a loud talker anyway, but we'll try to make this right. So thank you for coming this morning. It's been a long time since we were able to get together. And what prompted me to want to do this, and if this works out, we'll try to do this on a little bit more regular basis, was the fact that here in the independent living, we had our first positive resident last week. Last Friday, I think, is when I sent you the memo. So that prompted me getting a number of emails and a number of phone calls. So it always works better to have a one-on-one conversation or a one-on-22 conversation than to respond in emails, because there's always further questions. So I thought this would be a good time for us to get together, socially distanced, and talk a little bit about what's been happening. So let me start with, if you've been anywhere in my office, you'll see I got a whiteboard up there, and I've been keeping track about how many days we've been doing this, and this is day 159.
Wow.
Started on February 28th with the first memo. Things started out a little better, so to speak, and certainly easier for me to manage because everything was shut down. So I didn't have quite as much to worry about as I do now, because with some of the things that are opening, more and more people going out, more and more cases out there, more and more ubiquitous, it's a little bit more difficult to handle. I think we have done exceptionally well. I do. Thank you. We have had a total for residents on this campus of 2. One of those happened a while ago, and that was in the assisted living, and I did notify you of that. As soon as that person became ill, we sent her to the hospital. So she did not stay at the inn. You know, the inn's a pretty confined environment. So anyone becomes ill there, we want to ship them out when they've got the virus. So we did that, and then up till last Friday, that was our first independent living resident to come down and test positive for COVID-19. I actually expected it to happen before then, because many of you are out and about, but you've obviously practiced some good safety precautions. So and this person, I had a number of people say, how do I know? I don't have permission to share that person's name. They have not given me permission to do that. So I do have HIPAA regulations that I have to follow. But I alluded to in my memo, and I want to just say it straight out, this person is more or less confined to her condo. She has 24-hour care. This person has 24-hour care. I did ask that as soon as I got the positive results, and the reason that I tested this person was because one of the private caregivers was exhibiting some mild symptoms. So that caused me to test, and we can test. You'll see Cynthia and I around here testing people if there's any question. We tested that person came back positive. I found out at 6 o'clock in the morning on Friday, and I immediately called the desk and said, don't allow any of the caregivers back in the building, because I can't have them coming back. Fortunately for me, this person's daughter actually came into town the day before. So they are quarantined currently in the condominium, not allowed to leave. They're not sending the resident out to the hospital yet because there are not symptoms that would warrant that. We're able to take care of this person in the condominium. We're delivering food, we're picking up trash, we're doing everything. So another sibling came in, so there were 2 of them, because it's a bit difficult to take care of someone who just goes from the bed to the wheelchair, and they needed help. She needed help. So her sibling came into town. We're offering as much support as we can. I'm not letting any of my staff in there, which is why I felt comfortable being able to tell you not to worry about exposure. What did happen though, we provide lots of oversight to our staff. If anyone has any symptoms, and I mean by symptoms, I mean a runny nose, sneezing, anything, they have to call me or my HR director, Nicole. So all call-offs, all symptomatic people, anyone gets stopped at the desk, anything, I get a call. And we make a decision that, do we let this person in the building or not? If it's our staff and we just suspect if they got a sore throat even, we actually send them home. We will pay without them having to use any of their vacation time for them to stay home, so that I can be sure that they don't have any problems or anything related to COVID. If we, after a couple of days, they're not feeling better and we suspect that, we send them to a testing site. Meanwhile, there is no penalty for telling us this because the person is still paid and they don't have to use their vacation time. So far, in those 159 days, we've spent about $40,000 paying staff to stay home. So we're serious about it. We're going to do everything we can to keep the virus from coming in, as much as we know and that we can do. So what happened, what I found out, private caregivers don't have the oversight that we provide to our staff, which is what prompted me yesterday after discussion with Steve and Greg to say, I have a case here at the Bay Club, and the very same day I got a case at Jacaranda who was also having private caregivers around the clock. So I told Steve and Greg I need to do something with private caregivers. I need to require testing. The majority of our staff is tested every 2 weeks. That's as good as the day we do the test. So I understand that, but for right now, it's the best weapon I have outside of screening them for symptoms. So that's why I put into effect the requirement for private caregivers and private housekeepers to begin to be tested. Because for right now, it'll make them more cognizant. They don't have the benefits my staff have. They don't get health insurance usually from their employer or whatever, so they're less likely to call off. They know if they don't come in, they probably don't have a replacement, so they feel an obligation. So I understand all of that, but I need to assist in trying to keep it out of the building. So that's why I put that into effect. There are some testing sites that are doing better and better. Robert Taylor over here at 301, and there's actually a site at Home Depot that sends them to a lab in Bradenton that we've been able to get results from 48 to 72 hours. We also have a private lab that I use, and I use that to test some of you. I have tested some residents that have felt that they have some symptoms, and we ship that off, and that gets charged to Medicare. That's been really good for us lately because they opened another lab, so I'm getting my results quicker. That positive that I got back within 36 hours. So that was good. I retested that resident yesterday, as well as the 2 siblings, and I will keep doing that until we get a negative. And then we'll do it again until we get a second negative. Sometimes it takes a while, because even though, if some of you have been reading, even though the virus, it can still replicate and shed some cells, although not be infectious. So I don't want to take any chances though, and I want to make sure that I get the negative. All right. Now, as far as numbers, so what have we had total? I've been asked that question. 1 at the assisted living resident, and our first one here in Independent. As far as staff, how many staff have we had that have tested positive? I have a total of 9 staff that have tested positive. They have all done well. They have all done well, And of that 9, 7 have returned to work. The other 2 are still in the process of recovering. They cannot return to work until they get 2 negative. So we work with them to make sure that they get 2 negative tests before they return to work. Some people, it takes a little bit longer than others, depending on the age. This virus is wild. I would say of those 9, 8 of those staff had no idea that they had the virus. They were asymptomatic. And we caught it either because someone in their family tested positive. So that's the other thing I need you to know. If someone let's say our employee has a spouse who gets ill, they call us and they say, my husband just got exposed at work. We trace back and say how many people, how long was he with that person, were they wearing masks, and decide if we want that employee to come or not. So we actually take stock of spouses, children, grandchildren. We had someone who has a grandchild who tested positive. We made her stay home and then get tested before she came back. We have somebody in concierge whose husband has tested positive, like 3 times. He's having difficulty shaking it. Even though she's testing negative, I don't want her back until her husband tests negative as well. So we are being that particular about what we're doing, because again, I fully realize the test is as good as the day you take it. But I want to remain certain. So we broaden what we do all the way around to family as well. And what's happened now that it's so ubiquitous, and I have so many people that live under the same roof with relatives. There are many people that share a home. So now when one employee gets it or one of their relatives gets it, I have to ask lots of questions. When's the last time you saw them? Are you living in the same house? Are you sequestering yourself? Because even if they come negative, if they live in the same house, I don't want them coming to work. So I wanted to assure everyone, so when I said your chances of exposure to that resident that did test positive were minimal, there were a couple of reasons for that, because I know the travels that that person makes, and I know our staff did not have any one-on-one with that person. So I felt comfortable being able to tell you that. We will keep, this person was so asymptomatic, the resident, that her children thought for sure it was a false positive. So I had to test her again, and the second one came back positive as well, so that they would understand that that was a legitimate test. The problem with this virus is it can turn on a dime. The person who was at the inn who tested positive went to the hospital because she spiked a temperature. And she was 95 years old, had some comorbidities, all the things that I don't want to see and that I dread. But she only spiked that temperature the one day we sent her out. And I'm glad we sent her out, because then she became asymptomatic. But she tested positive 3 times in the hospital. And it wasn't until the 8th day that she became ill. And within 24 hours, she passed away. So the virus is just, it can be very unpredictable, just unpredictable. So we'll continue to monitor the person here. I want to continue to ask you to do the things that you're doing to be safe. You know, your neighbors send me emails and say, so-and-so's not wearing their mask. Can you please help me get them to wear their mask? I want to protect me. So I need to ask you to be cognizant of that when you see your neighbors. They do take this serious. Some people have various levels of how they feel about it. But regardless of that, we're all living together. We're all taking care of each other. This is who we have as each other. So if we continue the way we're going now, I feel comfortable that we're going to ride this out. Till when? I don't know. I did shut down dining when the numbers hit 15,000 that weekend. And the reason I did was because I felt, you know, my staff's the wild card, let's face it. They're out and about, there's lots of them. And I felt that all of you had more exposure in the dining room with people serving you and everything. So I wanted to mitigate that, which is why I retracted that service. Now, if the numbers start to decrease, I want my life back to normal too, just like you do. If those numbers start to decrease, I don't believe this weekend's numbers, because the whole entire East Coast shut their testing sites down. And they shut them down because of the storm. So those numbers we just recently got, to me, aren't real numbers yet. You know, they were gonna shut down the sites on the West Coast, but because the storm moved enough, they kept them open. So I'm not comfortable yet that those are legitimate numbers for me, considering the testing sites were shut down for 3 days. Do I believe in testing? I absolutely do. It's helped us keep people isolated. It's helped me keep my staff safer, you know, and more tests mean more cases, sure. But if you don't look at a thermometer, it still doesn't mean it's not 93 out there, right? So I am a proponent of that, and anytime our staff is feeling however they're feeling, we send them to be tested, and we do it here. So are there any questions that I can answer, Mr. Reed?
Yeah, the elevator, which is a very vulnerable area, how often does it get disinfected?
The question was, the elevator is a very vulnerable area. How often does that get disinfected? I know that they do it on a formal basis at least twice a day. Surface, if you've read some of the recent research, you'll find out that they're saying the surface and fomite exposure and way to contract this virus isn't as much as it was in the past, because when they did those tests, they had such a concentration on those surfaces that you probably wouldn't get that high a concentration. At this point, I feel comfortable with what we're doing with the elevators. It's a question more of person to person, try not to crowd the elevators much. I suggest you use your knuckle to push that button rather than your finger, but we're doing it on a formal basis twice. Yes, sir.
We noticed in the breakfast room for the continental breakfast, people that are not residents have caregivers come down and bring them up breakfast. Now, these people are uncontrolled as far as we're concerned. They could be carrying the virus in.
So the statement was, we have people that have caregivers that come down. Now, if they're caregivers that work for me, they are controlled and they are tested. If they are private caregivers, up to this point, you're right. We screened them at the door, but they weren't tested. But we are going to start having them be required to be tested. So yes, I think, Ron, did you have a question?
Yeah, we have a young woman who has been with us as long as we've been coming down to this area as a housekeeper. She lives alone with her husband, and she's currently in the hospital for a semi-urgent, semi-elective operation. So she's going to be out for several weeks. But number one, she's very good, and we really sort of love her as a member of the family. Number two, we would like to continue to support her in terms of have her keep her job with us. That's a long way of saying, can you keep us posted as to the best ways to get testing quickly once she's out? And she will have to be tested every 2 weeks, as you mentioned, and we're absolutely fine with that and understand it. But
so the question was, what can you offer us if housekeepers need to be tested or caregivers need to be tested? What can you offer us as a way to assist with that testing? Now, the memo that you received should have had a second sheet to it that lists the current sites that are available as of yesterday where you can be tested. Like I said in my memo, the best places we have found are the Robert Taylor Center, as well as the place in Bradenton. The lab that we use, we would be able to use that if that were the case. If you don't have insurance or your insurance doesn't pay, currently it's $95 a test. We have had people use it that have gone out of state or having on vacation. That's the other thing. If my staff go away for the weekend and they go for the East Coast, before any of my staff take vacation, they have to talk to Nicole and I. We need to know where they're going, and we need to talk to them about where they're going, because when they come back, if they go to the East Coast of Florida or they go out of state, they need to stay home until they get a negative test. So we're requiring our staff to be tested if they're going out of the immediate area. So they use that, and they can do a payroll deduction if they want to get tested to get back to work right away, or they can go to one of the sites that we have on that second page. And they've been pretty good. I think you had your hand up first, Karen, did you?
Yes, how will our caregivers and helpers know to go get a test?
So how will the private helpers know to get a test? I asked in that memo that you give them a copy of that memo. Because I have no way of knowing who you have or how often they come. My people at the desk know for the most part, but I don't know everybody. So I asked if you would please give them a copy. Yes, Nancy?
All right, I have a private person. I will give her the option of getting tested so that she can keep working. But you mentioned $95. So I think if you have somebody working for you, I will then offer to pay the $95 because I don't think she can handle that, and she has to do it every 2 weeks.
Right. Now, if you go to one, so the statement was, I mentioned $95. That's only if you use our private lab. At this point, our lab has been getting results back to us at a 48-hour maximum, usually in 36 hours. The labs are becoming just so overburdened, so I was fortunate that they opened another site. But your person can get it for free by going to one of those places I listed on that additional sheet with the memo. Those tests are of no charge to the person going.
And they are to bring back some written piece of paper.
Right.
Now, we just learned about this last night. By the time the person gets tested, it could be a couple of, well, it could be a little while.
Right, which is why I said we'll wait till next week, because you needed some notice. I realize that. So if in the next couple of days you tell your person, by next Wednesday or Thursday, they should have some written results. Right, Mr. Green.
You know what the waiting time when they go for the testing?
I do, Mr. Green, because the question is, do I know the waiting time? And I do. It can be anywhere from 1 hour to 3 hours. It can be a long time. And I know that because our staff has to do it.
They gotta do it every other week.
Yes, sir. Yes, sir. I have, if someone has a better plan, I hope you can share it with me, but for right now, that's the, you know, we haven't had this kind of pandemic in 100 years. Whatever applied 100 years ago doesn't apply now, so we're kind of trying to do our best with the guidelines that we have and the resources that we have. It's not perfect by any means. I wish it was. It'd make my life a lot less stressful. And yours as well. Hopefully, CMS, that runs Medicare, is actually looking at requiring the staff that work over in any kind of skilled nursing or rehab to be tested once a week. And we're waiting for that rule to become final. If it does, they've assured us they're going to send us the machine. I hope they do, because we sure don't have that, and they're pretty scarce. But what they did was they sent it out to the hottest spots in the country. So 2,000 nursing homes received the machine and the swabs and the reagent. And they're supposed to be able to do rapid tests in 15 minutes with those. So I'm hoping that becomes a bit more ubiquitous with the machines, and that we get one here at the inn as well, because that would be very helpful. But for now, we're not a hot spot, so we're not high on that list. Yes, ma'am.
I'm Darcy Brower. I have cleaning ladies who come in every 2 weeks. I'm not sure that they're going to want to be active and do that. Are there people here who are cleaning, who I could use instead?
Just like many of you, I have a hearing problem when wear hearing aids, so I had to walk close to you. The question was, I have a cleaning person, and I don't think they're going to want to get tested every 2 weeks. Do we have people here that you could use? And yes, just please give Jeffrey a call, and he will get you on the schedule as best as he can. You know, we have many staff out. I still have staff out, so we work like a ping pong ball. I get 2 back and I put 3 out. I get 4 back and 2 more are out. So we're not at any point fully staffed, so Jeffrey may need to tell you need to wait a little bit till he gets somebody, but we will do our absolute best to accommodate you. You would also think in this time that it would be easy to hire people. It is not. In spite of the fact that we have ads up, I think people have been taking advantage of some of the unemployment benefits that they were able to get. We even had a couple of people apply that said, I'll apply for now until my place opens up, and I don't want to hire short-term people. It costs a lot of money to get people on. By the time you do a background check and a urine test for drugs and all the other things we do. So we've been still looking for staff. I think now with the fact that some of those unemployment benefits have been put down, perhaps more people will be looking for some employment somewhere, I hope, so that we can fill some of the empty spots that we do have. Any other questions? Yes.
How about the contest? What are those companies? They have to be tested too?
The question was, what about Comcast? Do they have to be tested too? We have talked to Comcast ad nauseum, and they cannot test their people because they cannot guarantee us the same person will come back. So they just send their people everywhere, and they will not assign us some technician. In spite of the fact that we have this contract with them and we pay what we pay, they will not help in that way. Which is why if we have someone come in, I have either Pam, we check them at the desk, we band them, and I have either Pam or Jeffrey stay with that person until they're done what needs to be done. Because I can't trust someone's not going to be walking around the building. Any other questions? I don't want this to be doom and gloom. I just wanted to fill everybody in. Have you found this helpful? Do you think it's helpful to have a discussion? Yes.
I want to thank you on behalf of all the residents in the buildings, because the scuttlebutt, the talk around here is, we feel very safe. We feel that you've done, that management, the staff has done a marvelous job in trying to keep us as healthy and away from the horrors of outside here. And Gail, thank you.
Thank you. Thank you very much. Everyone's trying. I mean, this is one thing that we can certainly say, we're in this together. We are in this together, and the staff has been exceptional. In my whole career, this has probably been one of the most challenging things. I didn't realize how easy it was when everything was shut down until it started to open. You know, I thought that was different. Well, now that everything's open, it's much different. So just know that some of the staff, when they do find out, you know, the 9 people we had here, they're devastated when they find out. because they just can't believe, for the most part, that they got it. We sit them down and we just talk to them about who did you talk to, who did you see, where was your exposure. I did have a housekeeper down in Jacaranda. That was a nightmare. She turned out to be positive. She was asymptomatic. And she had been in the assisted living, the memory care, and had 15 apartments in Independence she had cleaned. So that day we did 50 tests. Everyone, thank God, came back negative. So, you know, she followed her procedure. She kept her mask on in the apartment. She did what she needed to do, and it worked out. But again, she was asymptomatic. She had no idea. So even though, just so you know too, when a staff member might become infected, we say, do you have any idea where you might have got it? You know, and there still remains a little bit of a stigma for whatever reason to the virus. So most people say, no, I just come to work and I go home. You know, I told Nicole, it reminds me of the old, you know how everybody in prison is innocent? No one wants to say, oh, I was, you know, behaving inappropriately. We even monitor social media. Some of our staff, if they post something that we think might be dangerous, if we find them maybe at a party or something, we will confront them the next day. So we even, yeah, it's Big Brother, I know, but I got a lot at stake here. You have a lot at stake here. So we troll social media as well. And a couple of people have taken down their posts now, but I just want to make sure we're doing the best we can do. And I think everybody gets it now this far into it, right? So all we can hope is for a better fall. My fears is school's going to start. I have staff that have school-aged children, not as many as you would think, because when the children weren't going to school, I didn't have that many people that had to stay home. So school is going to start and then flu season's coming. So I'm hoping by then, you know, we've heard talk of a vaccine. I'm hoping that something positive comes, but those are the two things that I'm trying to prepare for. School and flu season. So we'll do our best and see where we are by then. So any other questions anyone might have? No? You've been great. Thank you for coming, and I appreciate it very much. Thank you all.